And we're going to be speaking about intimate partner violence and how to move forward in a positive direction, especially during this COVID-19 time that we're all experiencing. Audrey, thank you so much for joining us. We really appreciate it.
Super happy to be here. And it's not just because I've been practicing social distancing. I'm really excited that you're interested in hearing about this topic.
Yeah, this has been a topic that has come up in a lot of different conversations that I've been hearing about. So will you explain to us what intimate partner violence is so that people know the topic that we're talking about?
Sure. And a lot of people have heard domestic violence, as it's often called, but really domestic violence also involves other things like elder abuse or child abuse. When we're talking about intimate partner violence, it's very specific. It's perpetrated by someone who is an intimate partner or was in the past or wishes to be in the future. And what we're talking about is really a pattern of behaviors, so controlling, coercive behaviors that are meant to establish power and control over another person. So this can pop up in many different forms. It could include physical violence or sexual violence. But if you look at the power and control wheel, which we have in our office and I use almost every day, a lot of people will forget about the psychological aggression that is so important in these relationships. And some of my patients who are in the most dangerous relationships have never had a black eye. They've never been sexually assaulted, but their every move is controlled. So from the time they wake up to the time they go to bed, they're told whether or not they can leave the house, what they should wear, how they should do their hair, who they can associate with. So if you look at that power and control wheel, these are just tools that are used to maintain that power and control. So things like isolation, using the children, using male privilege, so not involving you in decision-making, using economic abuse, not letting you go to school, get a job, keep a job, or access bank accounts, threats of violence, threats of suicide. And so a lot of people will experience all those things on the inside part of the wheel, but have never been hit or sexually assaulted, so they don't consider themselves as necessarily being in a really unhealthy relationship. But all of those things really affect people's health. And these things cross all boundaries too. So socioeconomic boundaries, racial boundaries, religious, they affect all people. And heterosexual relationships, same gender relationships. So it is a common, unfortunately, and really serious problem that affects millions of Americans. But the good thing is it is a preventable public health problem.
And as a healthcare provider and a healthcare system, what is kind of our role in this, and what should people know about what a healthcare system can do for them?
Well, and this is the really exciting thing to me and why I keep talking about this issue, because I see so much potential for healthcare providers, because the evidence and data really does show that if we screen, particularly for women of reproductive age, if we screen all these women and we identify people who are in intimate partner violence relationships and we connect them to resources, the evidence shows that we decrease violence and we can improve health and decrease healthcare costs. So huge opportunity there for us.
And if you know someone or you yourself is experiencing what you just described, should they go and reach out to their healthcare provider for support? Like, are you a good support system for someone to call if they're feeling that way?
Yeah, it's important to know that healthcare systems are a really good place because there's free, confidential help for them, and we can connect the dots. We aren't the experts in this area. We can't solve all problems, but we are kind of one piece of the puzzle as far as screening, identifying the problem, and then connecting that patient to resources. So it's a really good place, actually, to discuss this problem.
And with COVID-19 specifically, how has that affected intimate partner violence and kind of changed the landscape a little bit in how things are going?
Well, as you can imagine, I mean, we all feel isolated. Patients who are in these relationships are even more so isolated. Tensions have increased, financial stresses have increased, and you look at families who are experiencing violence. In the past, maybe the kids went to school and maybe the victim went to work or school herself, and now everyone is at home and not able to reach out to other people for help. And so that has made things worse. We know from our domestic violence advocates that the calls in Utah have increased 50 to 75% for most advocates who are providing resources. And with healthcare, it's been tough for us because often we'll screen people at annual exams, or some of the pediatricians are screening at well child visits, but we're only seeing essential visits right now. So that really minimizes the touch points with victims. But we are doing video visits at Intermountain Healthcare. And so I encourage people to reach out that way. And we're just going to have to be creative for the next couple of months.
So if yourself is experiencing an unhealthy relationship, what are some things that you need to know?
I would say if you're going through this, really 4 important things to understand. Number 1 is you're not alone. Unfortunately, this is a common problem, and so many of my patients who are experiencing this feel so isolated. Even without COVID, they felt isolated, and they felt really guilty and ashamed. But just know you're not alone. And secondly, you don't deserve this. Nobody deserves it, no matter what point you are in your life. So say everything else in your life is going fantastic, or maybe you have a substance use problem, or maybe you have a mental health problem you're struggling with. No matter what is going on in your life, you do not deserve to be called names, put down, and controlled. And then third, just I encourage people to think about the connection to their health, because so many of my patients who are survivors and have been victims, they are tough. They're really tough, resilient, smart people who are great parents and kind of mama bear parents and doing what they can to survive. And so they're not kind of pausing and thinking about how this really is toxic to their health. So their mental health and their physical health. And so I encourage people to pause and think about that and think about reaching out to healthcare providers on the issue. And then finally, most importantly, understanding there are teams of people available and just waiting to help out. So there are advocates that can help you through Domestic Violence Link Line in Utah, connect with the advocates in your area and develop a safety plan. And there are lawyers who can help out with legal matters, financial support. And so really just try to safely reach out in the ways that you can. The hotline.org, if you are unable to make a phone call, the hotline.org is a great place because they have a chat line, and all of these options are free and confidential.
That's really great that there's resources in the community that people can access. So what should we all be doing to help our friends and family and coworkers kind of feel safe and supported during healthy relationships?
Well, I really, I wish that 20 years ago when I was in medical school and residency, I was taught a few things, because I think I would have been able to help so many more people earlier. It's really within the last 5 years that some of my patients who are nurses and healthcare nurses and physicians who have been in domestic violence relationships have reached out and shared their stories with me and kind of pushed me to go back and look at the data and the evidence and really look at this issue and figure out what is going to help people. And I would say, just as a community member, understanding what your resources are is number 1. So the first thing you need to know, the UDVC link line, that hotline, and the hotline.org, those are amazing resources. So as you go out and you talk about this issue with friends and family members, you got to assume there are going to be survivors there, because 1 in 3 women in Utah will experience this in their lifetime. And studies show that 1 in 7 men in the United States experience extreme intimate partner violence. And so as you talk about this, number 1 thing, know what your resources are. And those 2 resources will get you started. The second thing is just listen and believe. So it's so powerful to listen to people, and so many people they may talk in a roundabout way about the struggles they're having in the relationship, and often it's 10 times or 100 times more difficult than they're really saying. So really listen, believe people who say they've been sexually assaulted or experienced intimate partner violence, and avoid the rescuer mode. It's human nature. And this was a real struggle for me as a physician. I want to identify problems and I want to fix problems.
Yeah.
And that's it. It's very hard for me to screen for this problem that I am not going to fix. They are complicated problems that involve complicated issues, finances, children. And of course, if there is an emergency, you should call 911. But the vast majority of time, we need to listen, believe, and help people connect to resources and not feel like we have to fix the problem.
Mm-hmm.
The third thing is just teaching healthy relationships. So we have a good form from the Red Flag campaign that looks at healthy versus unhealthy relationships, understanding and educating yourself on what that looks like, and then teaching our children from a very young age, from pretty much when they can first start speaking about what a healthy relationship looks like. And we are not going to make any progress on this unless we have boys and young men and adult men engaging in this, modeling and teaching healthy, nonviolent, consensual relationships and what that looks like. And then finally, the last thing is support local advocates. The Utah Domestic Violence Coalition helps support member programs who are spread across our state. And these advocates are doing the really hard work. They are essential workers during COVID. They are showing up. They are creating safety plans for folks. They are running shelters. And I think they're kind of forgotten about during these times. So whether it's just sending them a thank you note or appreciating them, sending them donations when it's acceptable during COVID, and just financially supporting these places most of them are working on shoestring budgets. So that would be my final advice and something we can all do.
And those places that you were talking about, like the domestic violence shelter, they're not closed necessarily right now. Just because we're in this weird time doesn't mean people can't use those resources, correct?
That's a great point. They are open, they are running, and they are doing the best they can in these circumstances. They are still responding to calls. They're helping patients develop safety plans for themselves and long-term plans. And so they are available. And so if you can access that at a safe time, I highly recommend it.
Last question for you. If you're a child and you're experiencing something like this with your parents, you're watching this happen, is there a place that children specifically can reach out to about their parents to try to get them help? Or what's the safest way for them to kind of be involved without hurting the relationship even more?
I would just emphasize that if there is violence and you feel threatened or someone else's life threatened, definitely don't hesitate to call 911. Law enforcement can help out with that. But if it's more of a time of processing all this information and what healthy versus unhealthy relationships look like, and you're worried about it, that Utah Domestic Violence Link Line is a great place to start, because they're a centralized location, and then they can help figure out who is available in your local area who may be able to help you.
That's great. Is there anything else you kind of wanted to mention to us about this topic specifically, or what people should know?
I would just say I'm so optimistic about this, because the state of Utah, family is first and is so important. And when we have problems, like higher rates of domestic violence than the national average, we're not going to be willing to accept it. And so there are so many folks, there are legislators working on this. Law enforcement has done a phenomenal job over the last 5 years of improving things for victims of violence. And I know people don't like to hear about this topic because they get depressed and overwhelmed. And yeah, we're not going to fix all violence in the world, but on the other hand, the science really does show us that this is a preventable public health problem. So if we all do our part and work together, we can really make a big impact in the next 3 to 5 years.
Well, thank you. I think this topic is super important, like you mentioned, and we really appreciate you taking the time to talk with us about it. Intermountain also has a resource. It's an emotional relief hotline that people can call. That phone number is 833-442-2211, and it's available 7 days a week from 10 a.m. to 10 p.m. That could be another resource that you utilize during this time. There's also our COVID-19 hotline for people who are experiencing mild to moderate symptoms related to COVID-19. That phone number is 844-442-5224. Thank you so much again, Audrey, for joining us. We really appreciate it, and we'll talk to you guys next time.
You're welcome. Thanks so much.
Thanks.
Bye-bye.
Bye-bye.